All right, good afternoon, everybody, and welcome. My name's Lawrence. I'm the General Manager of North America for Galen Growth, and today we are here to go over an analyst briefing for digital health in Massachusetts, the 2002 year-end report. Why don't we just jump right into that? And hold on one second, having some tech. Hold on one second. For some reason, my thing is not working. Oh, there we go. Okay. So let's jump right into the report here. And the first thing that we'll talk about, why the state of Massachusetts and the ecosystem. If you take a look at by the end of 2002, there were 248 ventures founded in Massachusetts. That's over 9% of the U.S. health ventures were founded in Massachusetts, with that number, making Massachusetts the third largest ecosystem in the U.S., led by California, New York, and then Massachusetts, as you can see. And then the rest of it making up. And with the growth, with a GAR rate of 6% over the last 5 years. 40% of the ventures were founded in Boston, and about 28% of the ventures in Cambridge. So that's a high-level view of the Massachusetts ecosystem development. Next, we'll kind of dive into, hold on one second, to the clinical evidence here, and how that plays out within the ecosystem itself. And then I was at over 20% of the ventures have a clinical evidence score of over 40%, which is pretty significant when you compare it to other areas within the country, with remote devices leading that at 39%. So again, 20% of those had 20% of the ventures had a clinical evidence score of greater than 40%. Why is that important? It gives clinical proof on why that these ventures actually do what they can say they can do in terms of their solutions. So again, that was the leading was remote devices, followed by patient solutions, and then by clinical trial solutions in terms of the percentage that had an over 40% clinical strength. And then we can go into the funding here itself. As we can see, in 2022, delivered over $262 billion in total venture funding in the state of Massachusetts. That was down 59% year over year. Again, both higher than California and New York, are performing the regional area. Massachusetts ventures, 83% of the ventures raised funding either in 2021 or 2022. Therefore, these ventures should be very resilient to the downturn that we've seen in funding now, since their funding was raised within the last couple of years. So again, that's we'll dive into that. Again, funding strength, 83% of the ventures, as we said, and comparing that to North America, which was only 65% of the ventures globally, only 51% of the ventures raised funding during that same period. Okay. The key therapeutic areas that we saw funding go to, leading the pack, was oncology, with Boston leading most of that funding with $150 million invested in Boston Gene. So again, leading the pack there. 28% in other therapeutic areas. Second place there was mental health, with $289 million in total funding in 2022. So that's an overview of the key therapeutic areas and what that funding looks like for 2022. So that is, let's take a look again at, one of the ventures here, if I can get into that. Bear with me for a second. Hold on one second. Let me take a look and pull something up here, and we'll dive into one of those ventures. Hopefully everybody's having a good day today. Bear with me, I'm having a little bit of technical difficulty here. And here we are. And okay, here we go. Bear with me one more second. And as I was saying, Boston Gene led the pack, and we'll take a quick look. We are in the Health Tech Alpha platform. And as we can see, here's the funding for this particular venture. If you ever log into the platform, you'll see this under the funding tab. You can see that this particular venture outperformed its peers significantly, as the medium peer did 20 million. So all the peer ventures that of this particular venture, so they way outperformed at 150 million. So there we go. Let me jump back up here. So, and that concludes today. There's not much. If there's any questions, feel free to type some chat in. If you would like to see anything within our platform, let me know. Again, Galen Growth is the global leaders in private market data for ventures, intel, and insight. All right. Any questions? Feel free to type them in the QA. Okay, I got one question here on. Let me get back to that slide for you. Hold on one second. Yeah, so California, as you can see, California, you asked the question about California versus Massachusetts in terms of portfolio and strong clinical evidence. And yes, California and Massachusetts were very close. Not far behind was New York, but again, trailing somewhat in terms of the clinical evidence strength of the ventures. With 20% of the ventures in California having strong clinical evidence above 40 score, and 20% in Massachusetts having the same, compared to the rest of the other states, which hovered around 14%, again matching with New York. So significant statistic in itself. And then another question here was in terms of the funding. Yes, as you can see, let me make this a little bigger for you. Massachusetts was at 9%, followed by New York which was at 14%, led by, I should say, shortly before that, New York, which had 14%. And again, California at 32%, and all the other states totaled 45%, if that answers your question. So again, the growth rate, the GAR rate for the ventures of the last 5 years is at a 6% rate. Okay, any other questions? All right, well, that will conclude it today. I want to thank everybody for attending. And again, take a look at Health Tech Alpha. And, you can go to the Galen Growth site as well to download reports and those things. It's www.galengrowth or healthtechalpha.com. And you'll be able to access the platform and take a look at those things. So again, thank you everybody for attending. Have a great day, rest of your day.